Hormonal contraception. Hormonal contraceptives are, as the name implies, hormones that when taken orally, transdermally, intravaginally, or intramuscularly, such as fluctuations in normal menstrual cycle, the ovulation or sperm transport does not occur. Here are the examples of contraceptives such as oral, intravaginal, intramuscular, and transdermal. Contraceptive use reduces the need for abortion by preventing unwanted pregnancies. Popular combination oral contraceptives prescribed in the United States are monophasic pills, contain fixed doses of both estrogen and progestin throughout a 21-day cycle. Biphasic preparations deliver a constant amount of estrogen throughout the cycle but varying amount of progestin. Triphasic and tetraphasic preparations vary in both estrogen and progestin content throughout the cycle. Oral contraceptives have benefits in addition to preventing pregnancy, such as decreasing incidences of
dysmenorrhea because of ovulation, premenstrual dysphoric syndrome, and acne because of the increased progesterone levels, iron deficiency anemia because of the reduced amount of menstrual flow, acute pelvic inflammatory disease or PID, and resulting tubal scarring.
Endometrial and ovarian cancer, ovarian cyst, and ectopic pregnancies, fibrocystic breast disease, possibly osteoporosis, endometriosis, uterine myomata, or fibroid uterine tumors, and possibly rheumatoid arthritis, or colon cancer by Skinder 2010.
So this is one of the 4 ways that woman can set a start date for a cycle of pills. The first is the Sunday start. It should take the first pill on the first Sunday after the beginning of menstrual flow. The second, quick start, begins pills immediately after a prescription is filled with increased compliance, reducing unintended pregnancies. The third one is first day start, begins pills on the first day of menses. The last one is after childbearing. A woman should start the contraceptive on a day or Sunday closest to 2 weeks after. So, this is the commonly prescribed medication come in. 28 pills dispenses or 21 active pills and placebo pills, each of which is labeled with the day of the cycle on which it should be taken. A lady who uses extended use tablets will only menstruate every 3 to 4 months or once a year after using them for 84 days. Labril is a brand new, low-dose combination of estrogen and progestin that is taken continuously throughout the year, without a break for a placebo or pill-free periods, to entirely stop menstruation for a whole year. Progestin-only pills. Many pills are the common name for oral contraceptives that only contain progestins, and like combination versions, must be taken religiously each day. Ovulation may occur in the absence of estrogen, but since progestin prevents the endometrium from properly developing or sperm from freely entering the cervix, fertilization and implantation will not occur.
NCP-based and family teaching and suggestion on oral contraceptive management. If the omitted pill was one of the placebos, disregarded it and take the next pill on time the next day. If you forget to take one of the active pills, take it right away. Continue with your usual pill schedule the next day. If you don't remember until the second day, you may have to take 2 pills on the same day, which is fine. Ovulation should not be triggered by missing 1 pill. Side effect and contraindication of all oral contraceptives: monolia vagina infection, breast tenderness, nausea, weight gain, headache, depression, thick throat, bleeding, mild hypertension. Advise all women taking COCs to notify their healthcare provider if symptoms of myocardial or thromboembolic complications such as chest pain, shortness of breath, severe headache, severe leg pain, eye problems such as blurred vision. The World Health Organization recommends women who experience migraines with an aura or those who take certain drugs from seizures avoid the use of oral contraceptive, as these women may be at increased risk of cerebrovascular accident. Several drugs such as barbiturates, griseofulvin, isoniazid, penicillin, and tetracycline decrease the effectiveness of COCs. Women using COC should return for a yearly follow-up visit for a pelvic examination, pap smear, and breast examination, as long as they continue to use this form of birth control.
Hormonal contraceptives and effect on sexual enjoyment. Some women lost interest in coitus after taking COCs for about 18 months, possibly due to the long-term effects of altered hormones in their bodies. Sexual interest returns after they switch to a different method of contraception. Some women experience nausea for COCs, which interferes with sexual enjoyment as well as other activities. Next is estrogen or progesterone transdermal patch.
Transdermal contraception refers to patches that slowly but continuously release a combination of estrogen and progesterone. For 3 weeks, patches are applied once a week. In the 4th week, no patch is applied. A menstrual flow or ang pagdaloy ng regla will occur during the week in which the woman is patch-free. Following the patch-free week, a new cycle of 3 weeks on and 1 week off begins. While swimming or taking a shower, patches can be worn. If a patch does come loose, the woman needs to take it off and apply a fresh patch right away. If the woman is certain the patch has been lost for less than 24 hours, she doesn't need to use any additional contraception. A fresh 4-week cycle should be started with a new day 1 and new week to change the patch if the lady is unsure of how long the patch has been lost. Patches may be applied to 1 or 4 areas. First is buttocks. Second, upper torso, front or back excluding the breast. Third, upper outer arm. Fourth, abdomen.
Vaginal estrogen or progestin rings or Nova ring. Here's the video about Nova ring. What is Nova ring and how to use it?
Soft, flexible, plastic ring that goes into the vagina. It's really easy to insert yourself and stays in place for 3 weeks. After this, you have a 7-day break. It contains a combination of 2 hormones, progesterone and estrogen. These work together to prevent an egg from being released, to make it harder for the sperm to reach the egg, and to make the lining of the uterus thinner so an egg can't implant. The contraceptive vaginal ring is 99% effective at preventing pregnancy. But remember, it doesn't protect you from STIs, so make sure you use a condom too. You may experience some short-term side effects, but there can be lots of perks too, like clearing up acne, easing cramps, and making your periods lighter and more regular. If you're under 25, you can get the contraceptive vaginal ring from Brook Services. Alternatively, you can go to any contraceptive clinic or your GP.
Subdermal hormone implants. Side effects and contraindications. Weight gain, irregular menstrual cycle, depression, scarring at the insertion site, need for removal.
So here's the video about subdermal implants.
Ladies, kung naghahanap kayo ng 99.9% effective na family planning method, ito ay ang implant. Ang implant ay isang plastic rod na masasabing kasing laki ng posporo at naglalaman ng progestin hormone. Gamit ang applicator, ipinapasok ito ng trained at certified health worker sa ilalim ng balat ng braso ng babaeng nais mag-family planning. Ang bisa nito ay tumatagal ng 3 taon at maaari itong palitan kung gusto pang ipagpatuloy ang paggamit o ipatanggal kahit kailan. Para makasigurong hindi kayo buntis bago ang procedure, inilalagay ang implant sa unang 7 araw ng inyong monthly period. Kung kayo ay bagong panganak lamang, maaari na kayong magpalagay ng implant anytime. Kung kayo naman ay kasalukuyang gumagamit ng ibang family planning method at nais mag-switch sa implant, maaari kayong magpalagay agad. Side effects? Ang mga naka-implant ay posibleng makaranas ng temporary at manageable side effects tulad ng una, pansamantalang pamamaga ng braso kung saan nakalagay ang implant. Ang ganitong pakiramdam ay nararanasan sa unang 3 araw. Pangalawa, pansamantalang pagsakit ng ulo na maaaring mawala sa tulong ng pag-inom ng pain relievers. Pangatlo, common effect ng implant ay ang irregular menstruation dulot ng progestin hormone na nilalaman nito. Pang-apat, gumaganang kumain na maaaring makadagdag ng timbang na kayang maiwasan sa pagkain ng tama at pag-ehersisyo. Take note po, hindi lahat ng naka-implant ay makakaranas ng side effects na nabanggit. At kahit ito ay 99.9% effective na hindi kayo mabubuntis, hindi naman ito maiiwasan ang pagkahawa sa mga sexually transmitted infections or STIs tulad ng gonorrhea at HIV.
Box 6.2 estrogen-based oral contraceptive use, contraindications, breastfeeding, and less than 6 weeks postpartum, age 35 years old, and smoking 15 more cigarettes per day, multiple risk factors for arterial cardiovascular disease such as older age, smoking, diabetes, moderate or severe hypertension, current or history of deep vein thrombosis or pulmonary embolism, major surgery that requires prolonged immobilization, current or history of ischemic heart disease or cerebrovascular accident.
Complicated valvular heart disease, migraine with focal neurology symptoms, or migraine with aura, current breast cancer or diabetes with nephropathy, retinopathy, neuropathy, vascular disease or diabetes of more than 20 years duration, or severe cirrhosis or liver tumors. Women taking certain seizures, drugs such as phenobarbital or dilantin, and women taking rifabutin for tuberculosis treatment. Women prescribed certain broad-spectrum antibiotics such as tetracycline. Intramuscular injections, a single intramuscular injection of the both medroxyprogesterone acetate, or we can call the MPA, a progesterone given every 12 weeks, inhibits ovulation, alters the endometrium, and thickens the cervical mucus, so sperm progress is difficult. The injection is made deep into a major muscle, or buttocks, deltoid, or thigh, before the 5th day after the beginning of menstrual. Because the MPA contains only progesterone, it can be used during breastfeeding. The woman must return to a healthcare provider for a new injection every 12 weeks for method to remain reliable. So we have intramuscular injections, we have side effects and contraindications. For example, headache, weight gain, sadness, heavy or irregular periods for the first year, and no menstruation beyond our typical side effects. Women should consume enough calcium, or up to 1,200 mg per day, and engage in weight-bearing activity every day to reduce the risk of osteoporosis. This risk may also increase as a result of a loss in bone mineral density. For women, the black box warning from the DMPA or manufacturer advises against using the procedure for more than 2 years in order to prevent bone loss. Hormone contraception and effect on pregnancy. So we have 4. First is estrogen or progestin combination pills. If a woman taking an estrogen or progestin combo pill feels she is pregnant, she should stop taking any further tablets if she wants to carry the pregnancy. The term because excessive estrogen levels may be teratogenic to a developing fetus. Women who quit using sources might not be able to get pregnant for 1 to 2 months and perhaps for 6 to 8 months. Second, we have progestin. Impregnated rings or progestin patches. If a woman who uses a progestin ring or patch that gets pregnant, the progestin should have no impact on the growing fetus. Women immediately regain their fertility after giving up any or both treatments. Third, we have subdermal implants. The root can be removed if a woman becomes pregnant while using a subdermal implant, but the fetus shouldn't be harmed as the implant solely releases progestin. When the implant is removed after 3 years, the lady will nearly immediately become pregnant once more. And last, the MPA. If a woman becomes pregnant, the MPA, like other progestin products, should have no effect. A concerning posture effect for some women is that the turn to fertility is frequently delayed by 6 to 12 months. Hormone contraception and adolescence. Adolescent girls should have a well-established menstrual cycle for at least 2 years before beginning cirrhosis. Furthermore, the cost of maintaining a continuous supply of pills may be prohibited for teenagers. COCs have the added benefit of reducing dysmenorrhea and improving facial acne in some girls due to the increased estrogen or androgen ratio, both of which are appealing to the most adolescents and may increase their compliance rate. Hormonal contraception and the perimenopausal woman. Women approaching menopause are likely to be over the age of 35, making them less likely to be good candidates for COCs than when they were younger, especially if they smoke. Assist women in this age group in finding an alternative method that meets their personal preferences while remaining as effective as possible, such as an intrauterine device or IUD, progestin-only patches, or vaginal rings. Hormonal contraception and postpartal women. Women who are lactating should avoid estrogen-based contraception because a small amount of the hormone is excreted in breast milk and reduces the amount of breast milk produced. Women who want hormonal contraception are typically prescribed progestin-only pills or progesterone-activated vaginal rings until they stop breastfeeding. Intrauterine devices. An IUD is a tiny plastic device that is placed into the uterus via the vagina. A doctor must do a pap test, a pelvic exam, and a chlamydia test on a woman who are at high risk for STIs before they may fit the device. To ensure that the lady is not pregnant at the time of insertion, the device is placed before she has had coitus following a menstrual flow.
The IUD and IUS are two of the most effective types of contraception available. Depending on the type, you'll be protected from pregnancy for 3, 5, or even 10 years. Both are small plastic devices that are inserted into your uterus through the vagina by a doctor or nurse. The IUS releases the hormone progestogen. This works to prevent an egg from being released and thicken the mucus from your cervix, preventing the sperm from reaching the egg. The IUD doesn't contain hormones, but instead releases copper into the womb, which is toxic to sperm. This can also work as emergency contraception up to 5 days after unprotected sex. Both are over 99% effective at preventing pregnancy, but remember, they don't protect you from STIs, so make sure you use a condom too. Both have possible side effects, but they usually go away after a few months. The IUS can also help to ease cramps and make periods lighter. If you're under 25, you can get the IUS and IUD from Brook Services. Alternatively, you can go to any contraceptive clinic or your GP.
That's it. We hope you gain a lot of learning from this video, and this video presents by BSN2 Group 4.